Hey, what's up, guys? We're back again. This is the Get Home Bag Part 2. Last time we talked about the tools in the bag. This time we're going to look at the medical equipment. Alright, first aid stuff and see what we got in here. See if we're expired on anything. Which, I mean, like I said, I've had this bag for a few years. Depends on the stuff that's in there. And I don't remember the last time I replaced things. So, let's check it out. Let's get into it, huh? Alright. First thing we got here is a little first aid kit. A pretty decent sized little one. It's not very heavy. Pack a lot of stuff in here. But let's see what we got in here and let's see what's in good condition and what's not. Alright. So open it up and kind of see the inside here. We'll start on the left side here. Got a little sterile elastic bandage, roller bandage here with the little metal clips. That's pretty good. You want to have that. And it's sterile, it's in a plastic. We got some little medical tape. It's a good thing to have as well. There will be some items in here that I'll talk about in a minute. They're added items that we put in the kit. Okay. Okay, the last couple of things that I'm going to show you from this kit on the left, or I'm sorry, the right hand side, is it did come with one of these little compass looking deals. How good that is, I have no idea. Never used it. I have a bigger compass that works really well. There's a whistle, okay? It is really slim. It's a slim rescue howler is what it's called. Should I try it out? Yeah, I barely blew on it. It'd be a lot louder than that. Whistles are an incredibly awesome tool. They help with so many things. If you're lost, blow on this thing. Who knows? There might be somebody in the area. It might be a hunter, a farmer, a logger. Blow this thing if you got it. Oh, awesome. Good thing to have in here. That came with this first aid kit. We have a couple of instruction booklets here. Alright. This one here is for survival instructions. This is kind of cool. It came with this kit. Alright. It says, don't panic. Stop. And it's an acronym. S is for stop. Do not travel farther until you assess your situation. That's great advice. I give the same. I don't know why I can't talk. I'm sorry, guys. I give the same kind of advice when I do classes on active shooter. You need to assess the situation first, right? T in stop is to think. Should I stay here? Should I move? What is the likelihood that I will be found here? That was pretty good. The O in stop is observe. Look around and determine whether you can obtain shelter, water, and fuel for a fire at this location. This is really good information, okay? And that observe, being situationally aware. Situational awareness will keep you alive, alright? And the P for stop is plan. Decide what you should do and take action. Staying put may be the best choice, especially if someone knows where to look for you. Okay? And then it just gives some information on shelters and how to make shelters. You can kind of see that on there. Signaling, water, some different little things. Really cool. I'm going to be honest, the first time I looked at it. Alright? Yeah. Anyhow, the next one says medications on it. Alright, let's see what this one says. Non-prescription medication. Talks about the medications in the bag. So ibuprofen, acetaminophen, Difen, there's aspirin, and then it has insect bite or sting cream. Okay, and it tells you their uses and their warnings. That's pretty cool. That information should be on the container or the packets as well, pending. Alright. Keep moving on here. Another little booklet thing here, so a little bit bigger one. This one is on wound care repair burns and blisters. Talks all about that, how to dress a wound. Cool. Very cool information. Alright. And then in here we have all kinds of little antiseptic towelettes. Do these have an expiration date on them? These expire 2025. Okay, so I got quite a bit of these. Alright. Yeah, these are for cleansing of the cleansing a desired area. You know, good to have. A bunch of those, they're still current. Here's a sting relief that we seen in that little paper earlier. What about this one? What does it say? I know it's got to have one on here somewhere. Sorry about the weird noises. Huh. I don't know. I'll have to take a look at it and check it out. So, anyhow, sting reliefs are in there. This is a sterile non-woven sponges. 3" by 3". So they're basically like pads. This is a 2" by 2". 2" by 2". So we got sterile pads that dressing. These will be for stopping the bleed by applying direct pressure. Alright. We got a ginormous Band-Aid. Several other Band-Aids, different sizes. I think that's a Band-Aid type deal. It's just a brown thing, but it has adhesive on the back. So, anyhow, here we go. Stop the bleed. Bleeding and CPR. Cool. Good information to have. Alright. This is triple antibiotic ointment. Again, these should have some kind of expiration date on them. This one also came with a cool pair of tweezers and this little tube thingy here. Okay. These are a must. If you get stingers, if you get splinters, a lot of different things can happen. Great tool to have as well. Okay. So move that out of the way. Move some of these things back here a little bit. Alright, I told you I moved aside a few items that I've added to this little kit. One of them items I've added is Bleed Stop. Alright, this stuff is awesome. If somebody has severe bleeding and you cannot stop it with direct pressure, try that first. Then you can put this in there. Okay? It tells you how to use it. Okay, pour in onto the wound, apply pressure, and this Bleed Stop basically coagulates the blood. These expire February of 2026. I got a couple more years with these. Put them in your kit, just in case. And that's it for hunting, camping. You get in an accident, these are in the car. Or somebody else is in an accident and you're there, right? Next thing we put in here is MediHoney. MediHoney is medical honey. This stuff is awesome. It's for wounds and it's for burns. Okay, you can apply this on a burn and then put a dressing on it so that your dressing doesn't stick to it. And I believe these have an expiration date on them as well. If I'm reading this right, this says it's expired in 2021. If that is the case, this is probably not any good anymore. However, it is sealed. It's not been punctured at all. So I'm going to have to research that. See what happens. And the last thing in this little first aid kit that I want to show you is this. And this is what you call Arnica Montana. Okay, this is for swelling and pain in muscles from injuries. Okay, discoloration and that kind of stuff. Any kind of muscle injuries, you take these in the lid is where you're supposed to drop them off. You just twist this whole thing. It'll drop a few little tablets down. You put those under your tongue, let them dissolve. And these help with taking away muscle pain and things like that. And these are supposed to be better for you than aspirin and stuff like that. But they have a little cap system so that you don't touch it with your hands. Alright, cool. Let's see what else we got in the bag as far as first aid stuff goes. So I kept these in here with the first aid stuff. These are called dude wipes. Alright, obviously they're wipes. Multi-purpose wipes, we'll just say that. And hygiene is huge. Okay, especially if you're stranded somewhere or you're lost, you want to stay clean. You want to have something like that. These ones have been opened, and so these are dry. They still have a smell to them, but they're dry. I think if you apply some water to these, they'll come back to life. These ones have not been opened, and I can just feel that they're moist inside here. So hygiene is very important, so make sure that you're using something like that. And the last thing that we have in here for first aid right now is we have this trauma kit. This is for major injuries. This has your bandage kit, elastic. This has a cap tourniquet. There's shears in here. There's an airway kit, adhesive tape, surgical tools. There is a lot of major things in here, okay? And I will say, I'll let you know that my wife is a midwife and she does stitching and things of that nature and all kinds of other stuff. So this would be handy for our family. Or if we're at an emergency scene and we're the first ones there, or somewhere out in the middle of nowhere because we like to go camping and hunting and stuff like that, okay? So this is the basic first aid kit stuff that we have. I noticed that I don't have any of the aspirin or ibuprofen or any of that stuff in this kit, probably because it was expired. Okay, and so listen, if you don't have basic first aid and CPR training, I encourage you to get it. It is something that you're going to need, all right, for sure. You can look it up online. There's trainings all over the place you can take. You don't have to go take a CPR first aid class and be certified, but have the understanding of what to do in emergency situations. All right. Well, that's it for this time, guys. God bless. I love you guys. Prayer requests, praise reports. I'm not going to stop asking because I know they're out there. All right. And, well, until next time, God bless you guys. Thanks for watching.